Bengaluru, India, reported its first suspected case of human metapneumovirus, Hmpv, in an 8-month-old infant. This has raised concerns among healthcare professionals and the public. The case is under investigation, with samples sent for testing. This incident highlights the need for robust surveillance and public health preparedness. Bengaluru's proactive approach showcases its commitment to tackling health threats. Human Metapneumovirus, or Hmpv, is a common respiratory virus that infects people of all ages. Discovered in 2001, Hmpv is a major cause of respiratory infections, especially in young children and older adults. It spreads through respiratory droplets from coughs or sneezes and contact with contaminated surfaces. Good hand hygiene and respiratory etiquette are crucial to prevent its transmission. Human Metapneumovirus, or Hmpv, can cause a range of respiratory illnesses, with symptoms varying in severity depending on the individual's age and overall health. In many cases, Hmpv infection presents with mild, cold-like symptoms, making it difficult to distinguish from other common respiratory viruses. In infants and young children, Hmpv is a leading cause of bronchiolitis, an inflammation of the small airways in the lungs. Symptoms of bronchiolitis in infants may include cough, wheezing, rapid breathing, difficulty breathing, and fever. In severe cases, infants may require hospitalization for oxygen therapy and supportive care. Older children and adults infected with Hmpv typically experience milder symptoms, resembling those of the common cold. These symptoms include runny nose, cough, sore throat, headache, and fever. However, Hmpv infection can be more severe in older adults, especially those with underlying health conditions such as heart or lung disease. Complications from Hmpv infection are more common in individuals with weakened immune systems, such as transplant recipients, people with HIV/AIDS, and those undergoing chemotherapy. In these individuals, Hmpv can lead to pneumonia, respiratory failure, and even death. Therefore, it is crucial to seek prompt medical attention if you experience any worsening respiratory symptoms, particularly if you belong to a high-risk group. Section 4. Managing Hmpv Treatment and Prevention. Currently, there is no specific antiviral treatment for Hmpv infection. Management of the infection primarily focuses on providing supportive care to alleviate symptoms and prevent complications. For mild cases, over-the-counter pain relievers and fever reducers can help manage discomfort. Adequate hydration is essential for individuals with Hmpv infection, especially infants and young children. Encourage fluid intake by offering frequent sips of water, clear broth, or oral rehydration solutions. A humidifier or saline nasal drops can help relieve nasal congestion and make breathing easier. Preventing the spread of Hmpv is crucial in limiting its impact, especially among vulnerable populations. Good hand hygiene is paramount in preventing the transmission of the virus. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, using the restroom, and before eating. Vaccination against other respiratory viruses such as influenza and pneumococcal disease can help reduce the risk of co-infection and severe respiratory illness. While there is no vaccine specifically for Hmpv, staying up to date on other vaccinations can strengthen your immune system and protect you from potential complications. Section 5. Global Context and Future Implications. The recent suspected case of Hmpv in Bengaluru highlights the global nature of infectious diseases and the need for international collaboration in disease surveillance and response. Hmpv is found worldwide and is a recognized cause of respiratory illness in both developed and developing countries. Recent studies have shown a seasonal pattern of Hmpv circulation, with peaks typically occurring in the fall and winter months, similar to other respiratory viruses. This emphasizes the importance of heightened awareness and preventive measures during these periods, particularly in settings such as schools and daycare centers. Further research is needed to better understand the epidemiology, transmission dynamics, and long-term health effects of Hmpv infection. Developing effective vaccines and antiviral treatments for Hmpv is a priority to mitigate its impact, especially on vulnerable populations. The emergence of Hmpv as a significant respiratory pathogen underscores the need for continued investment in public health infrastructure, surveillance systems, and research to combat infectious diseases effectively. By staying informed, practicing preventive measures, and supporting global health initiatives, we can collectively work towards a healthier and safer future.